Good morning, good morning, good morning, WNOV family. I guess you didn't think you would see me again this soon, but apparently, Ebony Sally, who is the host of the Community Heartbeat for Outreach Community Health Centers, was going on vacation, probably well needed, and she apparently saw me last week and her topic today is similar to what I talked about last week. So she's just sent me an email. Wanda, I need you to do this show. And I said, well, let me check. Before I could check good, she already had the flyer up with my picture on it out on social media. And Ebony, if you hear me, you know I'm telling the truth. So then what do? You just show up. Show up. So before we get moving into our program this morning, I want to say good morning to Mr. Clark. How are you doing this morning? Who started that? Who started Who You With?
Well,
he did.
Wayne CK from WNOV used to be here. Actually, Bernie Mac, but Wayne used to say it. He used to say it all the time when people see him, we'd be like, "Who you with?" So I came up with You Food. That's how I came about that.
Because I didn't know if it was you or Angela. Because when she called and she always said, "Who you with?" So I thought it was her. But now I kind of got a backstory on that. And Mr. Debo, how are you this morning?
I'm fine this morning, Miss Wanda Montgomery, Mayor, Village President. However, I should be addressing you. I am great this morning.
Well, this morning you can just say Miss Wanda, since I'm not in my official capacity as village president, but I'm here in Ebony's seat. And Mr. Germain, today is not Wednesday, so don't come with no
questions today. No questions today. It's Friday, right? It is Friday, right?
It is Friday.
Yeah, sometimes I get my days mixed up. But how you doing?
I'm well.
I am well. You look great. You look like you're shining, even though it's gloomy outside.
You know what? We got to do what we got to do. When you know that the camera gonna be on you, you try to do a little something.
Camera action,
You try to do a little something. And let me tell y'all, I get up early. Every morning I'm up usually 4:30. There are 3 days that I go to the gym, and the other 2 days I'm on a prayer line. And this morning I was on the prayer line, and the prayer was good. I was listening and getting caught up, and all of a sudden I said, wait a minute, I got to be at the station.
Oh, Lord, you're going to make me late, Jesus.
Well, you know what? Grace and mercy.
Brought me through.
I got up. I mean, I wasn't in the bed, but I got up running to get ready so I could be here. But, I do like they used to do years ago with your kids. I laid my clothes out last night.
Yeah.
I didn't have to get up this morning trying to figure out what I'm going to put on.
See, but you feel better than when you have it ready and you know it's ready. So when you get up, take your shower, do whatever you do, you know where everything is.
You know where it is. You get up, and I'm starting my day, and I'll be moving on. Just keep going for the rest of the day, and hopefully I'll be able to get home early and begin to enjoy this weekend. So again, I am here. Guest hosting for Ebony Sally, who is the host for Community Heartbeat. And this is a program that is through Outreach Community Health Centers. And today we will be having some guests to come in. And, this month, you're going to hear a lot about women's health. I believe last month was Women History Month. This month is about women's health, and more specifically about Black maternal health. And so Outreach, Community Heartbreak is presented by Outreach. It's not just a show, it's a movement. And if y'all ever listen to Ebony, now I'm in a different stage of life than Ebony, but Ebony usually be on here fanning and talking about she need this, that, and the other. I am so grateful that I am not in that stage of my life. I'm telling you, And when I look at some people now, and for those of you that's out there that may be younger, it's real.
Yeah.
It is real. If you think, oh, they just putting on, they can't be that hot, they can't be sweating, they can't. I promise you, it is real. But what is also real is there are things that you can do to help manage yourself and manage some of those. They call them hot flashes. Some people call them they personal summers, whatever it is. And these men over here laughing because they don't have a clue.
Nope.
Not even close to what women go through.
Cool.
And so today we will have some people who are working. I'm calling them experts because they know more than I know. And so when they come in, we'll address different topics around women's health, specifically Black maternal health. But as I said, this is a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity, outreach. Community health centers will be featured. Well, it's featured each month here at WNOV, twice a month. And you can tune in every other Friday from 7 to 9 and hear Ebony with different topics that we hope that you will be able to get some resources and information. And certainly if you need a healthcare provider or clinic, connect with community outreach health centers. There's one located right down the street from the station at 220 West Capitol Drive. They just did a major renovation. So it's certainly a place that you want to connect to for all of your health care needs. I want to also remind the listeners, if you're a first-time listener or if you're a regular call in, there is a number that you can call. It's 412-444-5250. And then again, 414-444-5253. So you do have an opportunity to call in and ask questions. Now you can call in before our guests get here and ask me a question. I may not be able to answer it, but we certainly want to give you an opportunity to call in when they come. So a couple of things that we're going to be talking about is how you can stay healthy, stay on point. What are some vital signs that you can identify either pre-pregnancy, during pregnancy, after pregnancy, when you're moving in other stages of your life, how important it is for women to take care of themselves. And we don't wait till we're thinking about having a baby. You prepare your body and your mind before you get pregnant, because it does change your life. Physically, a lot of times changes happen, but also mentally, sometimes it changes your life. Financially, definitely changes your life when you have a child. So keep that in mind as we move forward on our show this morning. I believe I have a caller.
My bad. Good morning.
Good morning.
Hey, they got that vivid light on you, baby. You shine and you look good.
Well, what can I say?
Hey, there you go. Ain't no need to say nothing. Just take a bow. That's all.
All right.
This the question. This is what I don't understand. You know, with the healthcare situation and poverty. Now, right now, if you make, I think it's lesser than $50,000 a year, you can get health care, like from the state. But if you make $51,000, you got to go to the
exchange.
Yeah, and like rent today, and like $1,400, food expensive, gas expensive. That don't leave no room for no one to actually pay for their health care. And to me, I think this is another way that they trying to erase people off the globe. And this is crazy because healthcare should should be the most cheapest thing on this earth. And one more question. Today, we know who we are. A lot of us been knowing who we are and just haven't said anything. I don't see why these conversations don't come up on the radio and we establish this truth that we are the original Indians instead of being called black, because in the black dictionary, black is considered not alive or dead. We copper color people, we the copper color people. This is our land. And when they had that Civil War back in 1800s, they took the black men, or the black men went over there and warred with them. White people came over here. I mean, not Europeans, I'm sorry. The Europeans came over here because Big Mama took care of them because the British Empire wanted to do away with them. During that Civil War, the men went over there and helped them fight. And in the process, they allowed 7 other countries to come here and destroy homes, families. And when those men came back, they came back and their families was destroyed. Their land was gone. All this stuff is surfacing now. And I don't hear nobody talking about it. I mean, not like out loud. Why is it not being spoken out loud? You know, they talking about reparations. We don't need reparations. We need our land. I think that's more important than reparations because in actuality, we don't supposed to be paying for no taxes. Every immigrant that came over here, they supposed to be paying us for being over here. And Trump done mentioned it a couple of times, and I heard him say it, but it's like people ain't paying attention to what he said. You know, that dude, he talk a lot of flim flam, but he be saying some real stuff, and people don't hear it. So that's all. I just had to get that off my chest. It's a rainy day. It's gray. So I feel like I need to be at home in the bed, but I got to keep it moving.
Oh, you not at home in the bed? You at work?
I'm like a donut.
All right.
And
Listen.
the black man, I made the donut. Ain't that crazy?
Well, listen, you had a mouthful. You just covered a whole bunch of stuff. I'm gonna go back to the issue around the healthcare.
Okay,
And just so you know, there are a lot of programs, not just healthcare, but childcare. Um, could be healthcare is one, childcare is another. There are many resources that are available, and they are designed for people that are below the federal poverty level. And once you reach that, it could be $5. If that's what it is, you don't qualify. And so what ends up happening, unfortunately, is there are a lot of people who they kind of structure themselves. If they know they're about to get that to that benchmark, they'll ask not to get a raise, or they'll cut their hours so that they continue to be eligible for the benefits. It's sad, but that's what happens in order for people to continue to get the support that they need, because your money doesn't all of a sudden triple so you can cover those copays or cover the premiums. So I understand where you're coming from. It's unfortunate. It's the system that is in place. But what I will say to you too is, even those people out there that if you get to that point where you are no longer eligible for benefits, our community, and it takes listening to programs like this. being connected with other community resources, going to places that you might be able to get some of these services free or at very, very low cost. That are quality programs in our community. So it takes some research, or it takes talking to somebody that you may know. Sometimes we don't even know who is in our own family or our network who might be a part of a healthcare program that can tell us, if you do this, you can qualify for that. So it's really um, putting our own plan in place. We don't want anybody to refuse getting more money to take care of all of the necessities that you need to do. But I certainly understand. I hear you. And it doesn't stop. Even people that are older,
Yes.
such as myself, as I mature, I find that I'm required to pay more money for certain things that I didn't have to pay for when I was working full time and getting health insurance through a company.
Right.
So I appreciate your call. All the other things you talked about, listen, that's a whole show in itself.
Yes,
So,
ma'am.
and I know you'll call back. You need to call one of the regular hosts.
Yes, ma'am. I'm sorry.
No,
I'm
no,
sorry.
no.
I shouldn't work it on.
Listen. You're good. You are good. But you have a great day and keep on working. And
Oh,
don't
yes,
turn that
ma'am.
raise down.
Oh, no doubt. No doubt.
All
Hey,
right.
is Rod out? Is Rod out there?
Yes, sir. Yes,
Hey,
sir.
Rod out.
Yes,
I'm
sir.
your daddy. I was at one time.
Oh Lord.
Man, bye.
Yeah. Hey, you know that Tuesday boy. You don't be doing that. You talk about them mosquitoes, your dad.
Your friend. Your friend.
Have a good one,
All
man.
right. Love y'all.
Do we have another caller?
Yes, ma'am.
Caller. Good morning.
Sister. Can you hear me okay?
You're muffled.
I'm muffled.
Yeah, you're
How
pretty.
about now?
You're still the same. I don't know if it's. Are you on speakerphone?
How about now?
No. Hang up and call back, please.
Okay, babe.
All right. Thank you. Caller. We have another caller.
Good morning, Miss Montgomery.
Who is this? Angela.
Yes, ma'am.
Good morning, Angela.
How are
You know your voice is recognizable more than mine.
Okay, well,
Hey, how you
that's
doing
your
since I
one.
talked to you last week?
I'm doing okay. I'm just getting prepared for today.
Yeah.
Yeah, but other than that, I'm all right.
Well, listen, we will continue to keep your family up in prayer, and not just today, but moving forward.
Yes, ma'am. Thank you so very much. I heard your voice. I said, "That's Wanda."
And I heard them talk about you yesterday, talking about how she get in all the time. You got the Midas touch.
You better know it.
All right.
That's why I am who I am.
I hear you.
Angela.
I hear you.
You know, A come before anything in the alphabet, so I am first.
All right. Well, listen, you have a beautiful day celebrating your grandson, okay?
Yes, ma'am. I love you, and you guys have a blessed day. I love all y'all. Take
Love
care.
you too.
All right.
Caller, go ahead.
Good morning.
Good morning.
Can you hear me now?
Yes, you're much better, sir.
This is Rick calling you long distance from Germany.
Oh, hey, Mr. Rick.
And I just want to say welcome to Community Heartbeat. You're in the hot seat, and I wish you a good show. And I would like to say to your audience, I know everybody's not going to be vegan and vegetarian, but if you can reduce the meat that you consume, you will save your life and add to your quality of health. I'm done, lady.
All right. Thank you. All right. I think we're up on a break, and we're going to take a break. And then when we come back, we have our first guest in the studio on this morning. Morning again, Milwaukee. You are listening to the Community Heartbeat. And as we said earlier, today's show, we are talking about women's health, Black maternal health. And I am your guest host, Wanda Montgomery. I'm filling in for Ebony Sally, who is somewhere, I hope, enjoying her time away. And we will have a number of guests in the studio this morning who are experts in this topic area. Some of them are returning guests, so you may be familiar with them. But I do want to just share that April is Black Maternal Health Month, and it's also National Infant Immunization Week. And so we're going to identify 5 top health challenges for Black maternal health. The first is disparities in maternal mortality. Black women are significantly more likely to die from pregnancy-related causes than white women, often 2 to 3 times higher, regardless of income or education level. This reflects systemic issues beyond individual health behaviors. 2, implicit bias and unequal treatment. Many Black women report not being listened to or taken seriously by healthcare providers. This can lead to delayed diagnosis, missed warning signs, and poor outcomes during pregnancy, childbirth, and postpartum care. 3, limited access to quality care. Barriers such as lack of nearby providers, transportation, insurance gaps, and we heard the caller earlier, and fewer culturally competent services make it harder to receive consistent prenatal and postpartum care. 4, higher rates of chronic conditions. Black women are more likely to experience conditions like hypertension, diabetes, and obesity, risk factors that increase complications during pregnancy and childbirth when not properly managed. 5, social determinants of health and chronic stress. Factors like housing instability, food insecurity, economic inequality, and the long-term impact of racism contribute to chronic stress, which is linked to preterm birth and other adverse outcomes. So if that doesn't cause you to think about why it's important for us to have this conversation, I don't know what is. You may identify some of your challenges with all 5 of these. It could be 1 or 2, but we need to know some of the things that could impact our health, certainly when we're in the childbirthing years, pre-pregnancy, during pregnancy, after pregnancy, the things that can affect us. So this morning, we have a returning guest, and that is Dr. Hillary French, and she is an OBGYN at Outreach Community Health Centers. If you watched the show before, you may have seen her here. She is a new mom, so I can certainly appreciate the fact that she is here this morning, and it's what time? Some of y'all ain't even out of bed. It's 7:30, and she's here fresh to talk to you, and she got a 4-month-old at home. And those of you that know about babies, a 4-month-old, is he sleeping overnight?
No, ma'am.
Well, see, so she might not even been to bed. But she's here to share this vital information. She was born and raised here in Milwaukee. She went to undergrad at Xavier University in Cincinnati, Ohio. After undergrad, she went to medical school at Meharry Medical College in Nashville. While at Meharry, she became interested, I know I can say interested, in women's health, and founded the Women's Health Club on campus. All right. Is that club still going?
I haven't been to Meharry in some years, but I hope it's still going.
Yeah, I was just in Nashville 2 weeks ago. So beautiful place. In Jordan, I've never I had gone to Nashville probably over 20
I
years
love
ago.
it. I love
It
Nashville.
was a fabulous time. I enjoyed going to the Museum of
Yes.
African American Music. Beautiful.
Beautiful.
Just
Just the
Jermaine, have you
culture.
ever been there, Mr. Musician? Nashville,
Of course.
to the museum they have.
No, never
You
to the museum.
it's only 5 years old, but it's the Museum of African American Music.
Really?
So they have areas of gospel, of jazz, of R&B, and there's spaces that you can go in and actually, and you would probably go crazy.
What?
You go in, you can sing along with whoever, you can
Really?
play along. Oh yeah,
Uh-oh.
you got to go there.
I'm gonna put that on my
You
list.
got to go there. But we ain't talking about you today. We're not talking about music.
I'm going.
We talking about Black maternal. That was just a side note. Black maternal health. And so, Dr. Hillary, we want to give you an opportunity to give an opening statement, maybe.
Well, thank you so much for the introduction and having me on today with such a very important topic, especially in our Milwaukee community. Black maternal health is so important across the United States, and it's important because it affects so many members of the community, and we as a nation need to put all our resources in improving the numbers, because the numbers can just be catastrophic.
Absolutely.
And from 22 to 23, maternal mortality and other races have gone down, except Black women, and that's just
Wow.
unacceptable. So using platforms like this to get the message out and bring awareness to it is so critically important.
And as you say, the numbers went down for other populations, but not Black. And then we see on a national level where there are programs that are out there, but we have an administration that wants to say it's not needed. We don't need this because everybody's fine. But we know that that's not true. And so I appreciate that. And people need to hear, and some of those 5 statistics that I gave earlier, sometimes people think because I'm well-to-do, I'm educated, I'm this, I'm that my pregnancy is going to be wonderful. And we hope it is. But we also need to be aware of some of those factors that could impact our overall pregnancy. So I do have one of the things that Ebony does. If you don't know her, she come well prepared.
Yes.
So I have some questions that we will hope will generate some conversation this morning, and I may throw in a few of my own. But I do want to remind our callers that you can call in at 414-444-5250 or 414-444-5253. But Dr. French, I called you Hillary at first. Does it matter?
No.
Okay, I may exchange it. Your passion for women's health was deeply personal.
Yes. I've always grown up with medicine at the forefront. Well, my father is a retired general and vascular surgeon, and my mother is a retired radiation and oncology nurse. So medicine has always been a big part of our family.
Okay.
And my dad always instructed in me and my sister growing up the importance of taking care of others who otherwise are not able to take care of themselves, and really iterated the importance of taking time and listening to patients, because he would say medicine is not McDonald's, and so
not quick, just
it's not something
run you through
exactly. It's so much more than just that appointment. It's also, as you mentioned in the beginning, the outside parts of the social determinants of health,
right?
Housing, transportation, and then another personal why I personally made that leap is I was able to spend some time with my aunt, who passed away from breast cancer the summer before she passed. And
sorry to hear that.
Thank you. Just to be able to take care of women in their most vulnerable time is kind of what led me to where I am today.
Well, we appreciate you, because one of the things that we know is if you have a healthcare provider that you can relate to, I think that helps too.
Yeah.
Somebody that may look like you, or at least has some similar experiences, that kind of provides more comfort in who you're working
Yeah.
with.
Trust is so important because actually trust in your provider leads to better outcomes.
Absolutely. Absolutely. And I've been a few years since childbirth myself, but I remember back years ago, and I at one point in my life I lost a baby. I was at 6 months
so sorry.
pregnant, and it was interesting because I knew my body, and I would tell my doctor, "This is what I'm experiencing." "Oh, you're okay. You're okay." Well, I wasn't okay,
Yeah.
and so that I understand that they need to listen. I mean, most women know their bodies. They know how they feel. You may not know why you're feeling that way, but you know when things are different. So it looks like, Dr. French, we have a caller.
Yeah.
Good morning, ladies.
Good morning.
This is Rick again. I would like to ask about midwifery and the doulas. Is it beneficial to have a midwife or a doula assist you with pregnancy? And is there a difference between having a baby in the hospital versus having a baby at home?
Okay, Rick.
So doulas definitely have been shown to have benefits to outcomes. They're there for another source of support for patients, and can be there throughout their pregnancy. And there are postpartum doulas, which is also very important because I don't think a lot of people realize that majority of the deaths that occur are in the postpartum period, and that could be related to like high blood pressure,
Right.
heart disease. So definitely, especially in the Black population, doulas have been seen to have benefits and outcomes. Now, related to home birth versus hospital, the data has showed that still hospital has, in terms of outcomes, there are risks to having a home birth.
Right.
So I definitely would recommend having a team that you feel supported with at a hospital setting, just because when you're home, the variables that can happen can just range and not put you in the best situation if something dangerous occurs.
Right.
For instance, what would like that be like a postpartum hemorrhage? If a woman starts to bleed more than the normal amount, you want to make sure that you have access to the medications to assist with like an emergency scenario.
Right. And Rick, what I would say is certainly we want to listen to the OBGYN, but also keep in mind that we have a lot of different resources. You can do these things in conjunction or in collaboration with your healthcare provider. Last week we had a show that we had a person that represented doulas, and we had somebody that was a midwife. So it's a personal preference, but you need to know the risk and you need to know the benefits of anything you do. And it's not one size or one program for everybody. Each pregnancy is different. Everybody's experience might be different, but Dr. Hillary is here, and she's probably seen a whole lot more than I've seen. So I'm listening to the experts. It looks like, Dr. Hillary, we have another caller. Caller, go ahead.
Good morning. Thank you. My question is for the doctor. I didn't feel myself until my son was 7 years old. Is that a term or a name for it? Like, my body just didn't feel like it used to feel until like my son was like 7 years old, and I was just like, okay, I can finally feel myself. Is that postpartum, or is that just part of being a woman? And then my other question is, my OBGYN does not deliver babies anymore. He said he is not going to retire. He'll just do the office stuff and still see us for regular checkups, but he's retiring from the delivery piece of it. would you recommend that I change OBGYNs, or is that kind of usual to have someone that'll still be considered an expert, even though they don't deliver anymore, in your opinion?
Oh, sure. I can definitely. For your first question, do you feel like when you say different, do you mean from a physical standpoint or a mental standpoint or a little bit of both?
It would have been both. It was like I got my happy and joy back, where I can actually feel like I'm not so tired anymore. I'm appreciating the day to day and watching him grow.
Mm-hmm.
But prior to that, it was just as if I was still in that mental space of just racing all the time, circling around, not being able to focus. And now I feel like I felt probably like 10 years younger now, it seems like. And I don't know, it's definitely something that happened internally, because now, again, I just feel regular. Maybe it was part of COVID or something like that. We went through a lot in these last 7 years. So maybe now that I think about it, that has something to do with it. But I didn't know. I know people mention postpartum a lot, or the blues. I was just wondering, have you heard anything in your experience of women going through where it takes their body a lot to heal and feel back regular again?
Some of the things that you mentioned makes me think you did have some postpartum depression, possibly. Postpartum depression can show up for a year after you deliver. I know you said it's gone on now for several years, so there could be also a degree of something underlying there as well.
Mm-hmm. Mm-hmm.
But
yeah,
I can definitely see where you're, as a mama, sometimes like we're just running around and not focusing on us. And so that fatigue, plus, having to manage different things can lead to like kind of like a chronic depressive state. And I would advocate for you to talk to someone, if you haven't already, just about what you've experienced, because you might have not been able to work through those feelings, like, because now your son is 7, but maybe something was going on that you haven't really focused because you've been so busy. So that would be my recommendation to you, is to kind of start somewhere in terms of talking to someone and
yeah, I talked to my doctor, and as you can tell, it's hard to articulate. But then when I talk to my grandma, she's like, baby, you'll get through it. That's just part of being a woman. So I didn't know if there was a medical term, something that I can bring to him. But thank you for taking a stab at it.
Yeah, no, I think, it sounds to me like you did experience some postpartum depression, and maybe you have some underlying depression that I definitely don't want you to think that you can just work through it on your own, because that's we're not meant to do that. So the next time you go to the doctor, just say these are the things specifically that I'm experiencing, and that I would like to, a referral to behavioral health, just to kind of see if I can work through it with someone else. In regards to your second question, actually, I don't do deliveries anymore. So, I went back during COVID to get my MPH, because I saw the disparities in the patient population I was seeing at outreach, and I wanted to focus more on developing programs to address that need. So during that time, that's when I stopped doing deliveries. And in regards to that, you could definitely still be an expert in the field without doing deliveries anymore. And in some areas, people are doing more prenatal care and postpartum care with a hospitalist-based system.
Yeah.
So what that means is, like, at the hospital, there's people who take now shifts instead of like a private practice. And for many reasons, that there has been a shift to more of that model, just because of work-life balance and everything like that. People cannot necessarily.
I didn't know if it has something to do with people not having babies anymore, or it has something to do with that. But thank you for letting me know that a lot of doctors are transitioning to that new form of practice. And have a great weekend. Thanks for listening to me.
You're welcome. You have
Thank
a great rest of your day.
Thank you for calling in. And again, Our topic today is uh, Black women's health, maternal, uh, Black maternal health, women's health, Black maternal health. And as Dr. French said earlier, and the caller, I know that there's been a shift, even if you have your regular doctor, a lot of times that you see in his office. If you end up in emergency or your delivery, you may not get your doctor
Right.
that's there to do the delivery. It's whoever's on call.
Yeah.
But your doctor will show up maybe while I don't know if they show up while you're there now, because now I think you're only in the hospital maybe a day or so.
So typically it depends on like the whole delivery and your postpartum course.
Right.
But if normal, you usually go on postpartum day 2.
Okay.
And sometimes even postpartum day 1, depending on, maybe if this is like your second baby, you have kids at home and
Right.
baby's doing fine, but baby has to be cleared,
Right. Right.
And then C-sections usually
Take a little longer.
Right. Post-op day 3 is like usually when mamas go home for C-sections, but they can go home earlier if they're meeting their milestones, like their pain is controlled, bowel function, tolerating a diet, walking around okay.
Yeah. So something else that I understand, you've created a women-focused program at Outreach, like Step Up Divas and Cub Club. What impact have you seen these groups have on women in the community?
So Step Up Divas is targeted towards perimenopause and postmenopausal group. I found in my practice that these women feel almost forgotten about in terms of their symptoms. So I wanted to address those concerns in a group targeted towards physical fitness and learning more so about the body during that stage of life. I saw a lot of women just feel more comfortable like at our sessions. So we would meet and do like a physical activity or meet and discuss a topic and focus on nutrition and introducing new activities that the women may have not done before. And I think that was another impact, was trying things that were new and that they could implement at home. So one thing we did was a YouTube like free weights video together. Because that way, not everybody has access to a gym or can afford a gym.
Right.
So it's like, what can you do at home that we can give you a tool that you can actually use, as opposed to something that you might not ever pick up
having
again.
to go to the gym and pay a membership that you may not.
And then we were able to give the women free weights so that they can also take those home too. And in terms of the Cub Club, so the Cub Club was focused on postpartum and prenatal education. So we would go over different topics, and those range from labor delivery to, we had a lactation consultant come in, we had a personal trainer to come in to talk about exercise and pregnancy. So we found that the women who did come to those meetings also came to their postpartum visits, which was a clinical benefit that we noticed as I talked about a little bit earlier. A lot of the complications can arise in the postpartum period. So getting to that postpartum visit is so critical.
Yeah. So I know we have a lot more to talk about. I want to remind the listening audience, there's a lot of good information that's being shared on this morning. You should either be taking notes or this program is recorded. You can come back and listen to it and get some highlights of things that you may want to know. And I know everybody's not going to call in, or everybody may not be able to get in based on the call line, but we want to make sure that you take advantage. And you may know somebody out there, your cousin, your sister, your friend that is going through certain things. Have them chime in and listen to WNOV this morning, and it's on YouTube, Facebook Live, and certainly on the radio. So we want to remind you the call letters are 860 AM and 106.5 FM. I believe it's time for me to take a break. So we're going to take a break at this point, and we'll be back after they give me the go ahead. back, Milwaukee. This is Friday morning, and you are listening to uh, Community Heartbeat, which is with Outreach Community Health Centers. And if you were looking for Ebony Sally, I'm not her. Ebony is somewhere on vacation enjoying herself. I'm Wanda Montgomery, and I am the guest host on this morning. And that is clearly what I am, the guest host. I'm not the expert in women's health, but I am a Black woman. I have my own experiences, but we're going to hear from the experts on this morning. If you didn't know, next week, well, actually starting tomorrow, is Black Maternal Health Week. It's April 11th through, I believe, April 17th. So you may hear more information as it relates to Black women's health. But we want you, as I said earlier, we have people here. We have our OBGYN, Dr. Hillary French, who was in our first segment, and she's going to continue just a little bit while we transition into our next guests that are here. And you heard me earlier say she's got a 4-month-old. So we certainly appreciate her being here. And anybody that's got a young baby know they don't always sleep overnight. Matter of fact, they may be up all night, and you have to address whatever their needs are. But then we have two new guests with us on this morning, and that is Dr. Jasmine Griggs, who is Medical College of Wisconsin family medicine resident. So she's connected to Outreach and the Medical College of Wisconsin. So we're honored to have her this morning, and I'll give a little bit more about her bio in a minute. And then Dr. Nina is close.
Yeah.
Tell us your name, because I don't want to mess it up.
Yeah. Nana.
Nana. And the last name?
Ikogo.
Ikogo.
Yes.
See, I can say it right now, but in a minute I'm gonna forget. So I may just say Dr. Jasmine and then say doctor. Y'all help me out. I'm not, I'll get it. I have to say it over and over again. But before we let Dr. French leave, I want to give her an opportunity to just share anything she wants to say as it relates to the topic this morning that she wants to make sure that you know about Black maternal health.
Again, thank you again for using this platform to raise awareness about such an important issue. If you know anybody in your life that's pregnant or postpartum, make sure that they have the resources that they need, or if they're looking that they might need help, whether that be emotional support, just let them know that, hey, that they're not alone. There is healthcare providers that can address their needs and resources in the community, because it takes all of us to address this issue, because it's, like we said, not just in the clinic, it's also in the community, making sure people have transportation, making sure people have access to healthy foods, and making sure that people feel heard. That's the main thing I also want to say, is if you feel like you're not being heard, either speak up or reach out to your provider and say, this is what I'm experiencing. And if you feel still address, make sure that you still advocate for yourself, or you go to a different provider.
All right. Well, thank you so much, Dr. French, for joining us on this morning and sharing your knowledge. And keep in mind that all three of our guests this morning are connected to Outreach Community Health Centers. You can call, see how you can connect with them. We'll find out more about our additional guests, because they're both residents, and I'm going to have them explain to the audience what that means, because I know in terms of you're still in the learning phases, sort of. You're placed at different clinics or hospitals. We'll let you get more into that as we move forward. But we want to remind the listening audience that you can call in 414-444-5250, or 444 5253. And the line is open. We want to also remind you that you are listening to WNOV. The call in is 860 AM or 106.5 FM on this morning. So, Dr. Jasmine Griggs is a dedicated and compassionate family medicine doctor, committed to providing comprehensive and personalized care to people of all ages. Dr. Griggs is passionate about preventative care, helping patients live healthier lives through regular checkups, screenings, and lifestyle advice. Known for her approachable demeanor and patient-centered approach, Dr. Griggs takes the time to listen and understand each patient's health goals, making sure that they are an active participant in their health care. Let's welcome Dr. Griggs, and I'm going to give her an opportunity. Jermaine, where's the clap?
You know what?
You're not paying attention.
Right here. Bam. There you go.
Thank you.
And so we're going to give her an opportunity just to further introduce herself and her medical journey and where she is now. And I believe this is her first time being here at WNOV.
Correct.
So we want to give her a warm welcome. Don't call here trying to intimidate nobody, because I'm here. I can help her out.
Please don't do that.
She get double claps for the first time. Being on double clap.
Thank you so much. Again, my name is Jasmine Griggs. I'm actually initially from Oakland, California. Excuse me. I've lived in Milwaukee, Wisconsin for the last about 7 years or so. I went to Medical College of Wisconsin, which is like basically the medical school associated with Froedtert Hospital here, for medical school. And then I'm now a family medicine resident here in Milwaukee as well. And as to your question of what a resident is, every doctor that you know has gone through medical school, and then they do post-medical school training that may last for, I think, 3 to 7 years typically. And that's kind of an opportunity to kind of be more independent than you were as a medical student, but they're still supervising or attending doctors with years, decades of experience who are always kind of aware of every patient that you're treating and are kind of providing suggestions, seeing the patient independently or, with you as well. So that's kind of been my experience. I'm a third-year resident, so I'm going to be getting like in a job as an attending or like supervising like doctor myself, and then starting to practice independently in a couple months.
So was there a reason that you picked family medicine as opposed to any other particular specialty?
Family medicine, because it allows us to see patients basically from like what we say cradle to grave.
Right.
So everyone from newborn patients to elderly patients. And so that gives us an opportunity to like be very accessible to people. They don't have to like switch doctors the way that I did when I was a child and seeing a pediatrician. And then I got into like my early 20s and then I was no longer going to be seeing my pediatrician. If you have a family medicine doctor as your doctor, then you can stay with them throughout your whole life if you choose to. I think that definitely appealed to me. I think also because we see everyone, we see a variety of different things throughout our day. Whereas if you're like an orthopedic surgeon or something, you're only kind of dealing with like knees, joints, and so on. Every patient has that same problem. And so you're not having the variety that we do as family medicine doctors.
All right. Well, we appreciate you and you being here on this morning. And then our next guest, and I already told y'all, Dr. Nina.
Yes.
Nina.
Mm-hmm.
Ikugo.
Ikugo.
Help me out, Jermaine. Now, you've been here before.
Correct.
Okay. So her bio said, I selected family medicine for a variety of reasons, including its community focus. Family physicians are frequently ingrained in their communities, functioning as accessible and caring caregivers. I love the opportunity to address social determinants of health and advocate for underrepresented populations, thereby making a real difference in people's lives. And so, Dr. Nana, I will give you the opportunity to further introduce yourself and why you went in. You kind of said it here, but it comes better from you, not
Yeah.
me reading.
Sure. Yeah. Thanks for having me again. I trained in my home country, Nigeria,
Okay.
and then moved over because of my spouse here. My focus being like seeing a variety of people, like Jasmine talked about. Growing up, my father being a physician and my mom a nurse, I was always like very enthused about their community participation. And then eventually, after medical school, I just thought that I would want to continue seeing everyone, which is
Alright.
what family medicine entails. So that's the reason I'm a family medicine physician.
All right. And then just to give y'all a little background on Doctor, she's got a 10-month-old son.
Mm-hmm.
You know, I checked the stuff out because anybody that get up this early in the morning, it ain't always easy when you got little babies at home. So we appreciate that extra effort on today. And if any of you have been outside today, I thought the sun was supposed to be shining. It don't look like it. So be careful out there in this rain, because sometimes we don't drive according to conditions. So we want to make sure that you get to your destinations safely. But again, we are talking about women's health and Black maternal health this morning. So I'm going to pose some questions, and either one of you can answer or both of you can answer. So the first question is, preventative care is one of your passions. What are 2 to 3 simple things families can start doing today to improve their health? Dr. Griggs?
I would say drink more water.
Well, before we let them get, remember when I said earlier, get you some paper and a pen to take this information down, or be prepared to go back because this program is recorded. Okay.
So I would say drink more water. This is something that I struggle with myself. I drink a lot of like sugary beverages and whatnot, and a lot of our patients do as well. I think it's a simple thing that you can do though. Try to, at least a couple times a day, maybe like switch out a soda or chocolate milk or whatever you're drinking out with just a glass of water. That can be, of course, good for your teeth, and promoting good oral health. But also good for, your physical health and ways beyond that as well. And then I would say, this is a little less kind of what you might think, but I think that we also need to focus on like having genuine companionship in our lives, whether that be like good relationships with friends, family members, even like animals who can kind of be there, support you, almost kind of act as if like they're therapy pets in some cases. And that was just heavy on my mind yesterday when I saw a patient who was saying that, their dog kind of gives them a reason to get up and live their life. And, we see so many elderly patients who may be at risk for isolation. And, I think that these connections with other people is vital. And we know that it affects your physical and mental health.
Yeah. And not just calling people on the phone or on Facebook.
Yes.
A lot of us take personal interaction or physical presence by being on the internet and social media, and that does not replace the reality and the experience of really connecting with family and friends.
Yeah, and I think on social media myself, I feel pressure to kind of put on like put my representative out there.
Right.
It's not always a true reflection of myself and truly how things are going, especially if things aren't going so great. So I think, like you said, trying to like be face to face in particular with people, I think can be very helpful.
Right. Dr. Ikigo?
Okay, what I would just want to add to this is, as much as possible, for people to try to move more. Like, exercise doesn't mean you should just delve into it. Like start from what you're able to do.
Right.
Like you could just do 10 minutes work a day, and then as the body tolerates, you're able to accelerate from there. One other thing I would like to add is sleep.
Yeah.
It's very underrated. Being a 10 months old mom, I know what my life used to be compared with now. So, as much as possible, try to get some sleep. It helps to improve our mood. And then, even for people that have medical conditions, so sleep, moving, and exercise. Yeah, these are the two things I would advise people to do more.
Yeah. And as a person, I get up early in the morning,
Mm-hmm.
like 4:30. I'm not a doctor. I'm not going to no job at 5 or 6 o'clock. It's just a routine I've gotten into because I go to the gym 3 days a week at 5 o'clock. So I'm there, I'm on the treadmill, I'm walking around the track, I'm doing some type of, they have an e-gym where you go through a cycle or a circuit of different machines. And what I've learned is there are a lot of seniors because they get up anyway. So they're there. I've met a whole nother group of people that I would have never met if I was not going to the Y.
Nice.
But I know I feel different. And for me, I need to go in the morning because if I don't, trying to go back later in the day is just much harder. So I completely understand that. And I also know that just sitting around as you get to a certain age does not help. And I have people, I can't walk. Yeah, you can. You go to the mall and walk. You go to other, and like you said, you start out and you build on it. The one thing I will say for me personally, there is a difference in walking outside and doing the treadmill. Because when I'm walking outside, I can pick them up and put them down. I can get 4 miles quick. But I can't get that on the treadmill. Because if I go too fast, I'm probably going to fall. I mean, my mobility is not as it was years ago. So you have to know your own body, you know your abilities. And when you're starting out, it ain't always easy.
Yeah.
Some people, it hurts. Yeah, it's going to hurt for a little bit, but the more you do, the better you get. So I appreciate those tips. I hope y'all are writing them down. More water, sleep is important. And what I learned years ago, you can't sleep if the TV is on all night in your room telling you everything that's going on. We don't have TV in our bedroom. I took it out years ago. And I found out that I sleep better because that subconscious mind is not listening to whatever's on the TV.
Yeah.
So it makes a difference for me. Other people have to have music or TV or something. I understand we have a caller. Caller, good morning.
Good morning.
Good morning.
Good morning.
Your question?
Just say if I came in and I had a situation and I needed some medicine, would you? Okay, first of all, do you work in like private or are you public? You work in the private sector or the public sector? I never knew that. I don't know where you work. Do you work privately or publicly as a doctor?
I'll let them share, but this is connected to community outreach clinics.
Yeah. Okay.
So I think they do take people and they do an assessment whether you would qualify for their services, but they also do a number of things in the community that you could just show up and have access to. But I think in any type of program, you need to check and see if you don't have funds, what is available for you.
I wanted to, okay, like, would you, if you diagnosed me with some kind of cold, would you offer me Western medicine or would you tell me to go natural medicine?
I'll let them answer this. but they're connected to a medical facility, so they have to follow certain guidelines. They gotta.
Okay, no, you don't. They don't even gotta answer no more. All right, have a good.
You call and ask and answered your own question.
Well, no, I didn't. I mean, I didn't know where they worked at. I don't know them from Adam to Eve. But you answered my question for me by saying that they work for this.
Yeah, so they're connected. Just to repeat, they're connected with the Medical College of Wisconsin and Outreach Community Health Centers. They are residents. Okay. Oh, did he hang up? Is it time for us to take a break? I guess we got to take a break, and we will be back. Remember, you're listening to WNOV, Community Heartbeat, and we have a number of guests here this morning. We're talking about women's health, Black maternal health. We will be back after the break.
AURN News. I'm Jamie Jackson. A major change is coming to how the United States prepares for a potential military draft. Starting in December 2026, draft-age men will be automatically registered with the Selective Service System. The update comes after President Donald Trump signed the 2026 National Defense Authorization Act. The Selective Service says the move is part of a broader effort to modernize its systems and ensure they are ready in the event of a national emergency. The policy applies to men the ages of 18 and 25. The change comes as the Army has also expanded enlistment eligibility, now allowing non-prior service applicants to join from the age of 17 up to 42. The U.S. has operated under all-volunteer military since 1973. That's the same year the last draft took place. For AURN News, I'm Jamie Jackson.
From TMJ4 meteorologist Brendan Johnson with your Storm Team forecast. A few early sprinkles give way to partly cloudy skies. Later this afternoon, a lake breeze will keep lakefront temperatures in the mid and upper 40s today. Low 50s are expected farther inland. Mostly clear tonight with a low of around 35 degrees. We'll start our Saturday under a partly cloudy sky with increasing cloud cover later in the afternoon and evening with a chance of late day showers. Highs topping out in the low to mid 50s. Much warmer by Sunday with scattered showers and thunderstorms. Mostly cloudy. Highs around 70 degrees. Slight chance of rain Monday, partly cloudy with a high of 73, and then another chance of showers and storms by Tuesday, partly sunny with a high of 72. You can always catch the latest forecast at TMJ4.com. I'm meteorologist Brendan Johnson.
I'm Andrea Williams with your TMJ4 News update. A scary start to Thursday morning at Milwaukee's intermodal station. Police say a man's in custody after a sexual assault just after 6 a.m. Officers say security caught a 31-year-old man attacking a 33-year-old victim. When they stepped in, the suspect turned combative and security fired a shot. No one was hit. And Amtrak says train service was not disrupted. The investigation is ongoing. Meanwhile, Wisconsin tribes are urging Governor Tony Evers to sign an online sports betting bill. In a letter obtained by TMJ4, all 11 tribes say the measure has their support and passed with bipartisan backing. Evers has previously said he wanted full tribal approval, but today did not say whether he'll sign it. And the balance of power on the Wisconsin Supreme Court is shifting. Chris Taylor's decisive win expands the liberal majority to 5 justices, compared to 2 conservatives. She's the 4th straight liberal-leaning winner in the race. I'm Andrea Williams. That's your TMJ4 News Update.
Milwaukee Film presents the 2026 Milwaukee Film Festival, presented by Associated Bank, April 14th through May 30th at the Oriental and Downer Theaters. This year is the 12th year of the Milwaukee Films Black Lens program, with a singular focus on spotlighting fiction and documentary films by emerging and established Black storytellers. The Black Lens program explores stories and topics from across the Black diaspora and relevant to all in order to inspire conversation, celebration, and community. For more information on the films, go to mkefilms.org/series/Black Lens. That's mkefilms.org/series/Black Lens.
April is Financial Literacy Month, and it's time to talk about wealth in our community. Join us on Saturday, April 25th at 10 a.m. for The Story of Wealth, a special exhibit and panel discussion hosted by the Milwaukee County Office of Equity. Discover how policies have shaped financial opportunities in Milwaukee and learn how we can break down barriers to success. Join us at the Wisconsin Black Historical Society, 2620 West Center Street, and be part of the conversation that can inspire change. Don't miss out. See you April 25th at 10 a.m. for the Story of Wealth.
This celebration of America's 250th birthday is sponsored by Cindy Johnson's Allstate Agency, where they can't wait to meet you.
Gaylord Nelson. In the late 1960s, America was waking up to a growing environmental crisis. Smog choked major cities, and rivers were so polluted that they sometimes caught fire. Seeing the urgent need for change, Wisconsin Senator Gaylord Nelson proposed a radical idea: a nationwide grassroots demonstration on behalf of the environment. On April 22nd, 1970, 20 million Americans from all walks of life took to the streets, parks, and auditoriums for the very first Earth Day. This monumental event quickly sparked a historic wave of landmark legislation, including the Clean Air and Clean Water Acts. Senator Nelson didn't just organize a rally. He awakened a lasting environmental consciousness, ensuring that protecting our breathtaking natural heritage remains an enduring pillar of the American story.
BD Slam is a Christ-centered school specializing in sports management and the arts, designed for today's students. With small class sizes, virtual expert teachers, and a focus on the right use of technology, we're preparing students for the future, and we're proud to have 100% college acceptance. Join us for our open house on April 15th from 4 to 6 p.m. and meet our team and experience the difference. Enjoy food hampers, gift cards, and raffles, including a TV giveaway. Come see why families are choosing BD Slam. And if you cannot make it to our open house, call us at 414-501-3373. Again, that's 414-501-3373 to schedule a personal tour.
860 AM 106.5 FM. WNOV, The Voice.
Good morning again, Milwaukee. You are listening to Community Heartbeat. I am Wanda Montgomery, your guest host on today, and we are talking about women's health, Black maternal health, and we know that starting tomorrow is Black Maternal Health Week, and so we're focusing today on things that support, inform, our community, specifically women. But you know what? There may be a man out there listening and seeing and hearing something that may benefit your wife or your sister or cousin or friend. So we want to make sure that you take down pertinent information that's relative for you. Remember, we are on 860 AM and WNOV is on 106.5 FM. We're also live, Facebook Live. We're on a YouTube channel. All the things that can get you connected to this information. Program is recorded, so you can go back later and hear and see information that you think you might have missed. If you desire to call in, the numbers are 414-444-5250 and 414-444-5253. So we want to get back to our discussion on this morning. We have two family medicine residents that are connected to outreach and Milwaukee outreach clinics and Medical College of Wisconsin. And they are here sharing pertinent information for our community. So we're going to chime back in. So we have Dr. Griggs and Dr. Ikugo. And another question. As a family medicine physician, you care for patients of all ages. That means from birth to geriatrics. What do you love most about that continuity of care? And either one of you can answer. And not only that, it's men and women. It's not just so men in the listening audience or men that are here in the studio. If you're looking for a physician, you have two residents here that can offer you quality service.
Yeah, so I would say, excuse me. What I love is that I'm always on my toes. I'm always kind of being intellectually stimulated throughout my day because I'm just seeing everyone from, elderly patients to newborns. So I may see like first, patient who is like 1 week old coming in. And then I see a 40-year-old male who comes in and wants to speak about his high blood pressure. And then I see a 20-year-old woman who, wants to become pregnant and wants to know what are things she can do to improve her health and have a healthy pregnancy. And that's different from other specialties. Again, like what I said earlier about like an orthopedic surgeon or someone who's just kind of confined to seeing just a couple different problems. Like they may, just be seeing people with like knee arthritis all day long,
Right,
for
right.
example. And then I would also say it kind of gives us an opportunity to understand our patients on a deeper level because we have the opportunity to potentially see families.
Right.
So I may see a woman who's just given birth like a week ago, and I'm seeing her for a postpartum visit. But then the next week I'm seeing her like newborn for a well child visit, and we can kind of, have the opportunity to see how mom's doing even at that visit that's focused on the newborn. But because I see both of them, it kind of informs my care of both patients.
Do you care for, can you, or have you had the experience where you care for everybody in the family, the mom, the dad, and the children?
I've had the experience where 6 people in the same family all gather into the exam room at the same time, and we go like person by person.
Wow. Okay.
Mhm.
Okay. Dr. Google.
Yeah, so for me, I think it's just more of the relationships because you just get to see faces and follow them through time. And for one instance, there was a time that because I've known this patient for a while, I was able to know that there were some things that weren't normal just by her person, and we had to go further, make some diagnosis, get some medications, and then she came back a lot better. So it's about these people trusting you to
Right.
take care of their health and then coming back. That means like I can really trust what this person is telling me, and I think that's really rewarding. So that's one of the things I really enjoy about continuity of care.
And so you kind of alluded to trust.
Yes.
How do you build trust with your patients? We heard earlier that one of the issues with women going through their pregnancy,
Mhm.
sometimes the challenge can be they don't trust who their provider is, maybe because the provider can't really relate to them,
Yeah.
or they're not fully there, or they make assumptions about their patients that are not true.
Yeah.
So how do you build trust with your patients?
For me, I think mostly what I do is just like when a patient comes in, I slow down, I listen a lot. Now, what I'm doing is I really don't want to type so much so that it doesn't look like you're just talking and I'm doing
Right,
something.
right.
I listen in and then, as much as possible, I try to explain things very clearly, not using medical jargons, and create kind of a scenario where we come up with a plan.
Right.
And yeah, I think when you make it like a communicative thing, not just whatever you have to say, the
Right.
patient gets to trust you, knowing that I'm also part of this, and subsequently, yeah, we just build it from there. So slowing down, listening, explaining in very clear terms, and then having a plan that is both from my side and the patient side. I think that's when they get to trust me.
Right.
Yeah.
Right. Dr. Jasmine, how about you?
I agree with a lot of what Nina said. I think I generally try with every patient that I see to just take a pause before I go right in the exam room, to give myself to take in a deep breath and realize this may be, the end of my workday. I may be very tired. But this may be someone who's coming in and they've been waiting to discuss this problem for weeks or months.
Yeah.
And it may be an embarrassing problem for them. It may be something that, takes a lot of courage for them to bring up and share with a complete stranger, or even, someone that they may know as their doctor for a while.
Right.
So I try to keep that in mind. I think also I just try to be very humble, admit at times that I make mistakes, that, even to patients at times, that, I'm imperfect. I want to provide you the best care. I'm not going to force you to do anything you don't want to do. I want to provide, suggestions based on the best medical advice. And again, just kind of, approach patients with that mindset.
So, trust on different levels, because you have people that may come to you that had a horrible experience with somebody else. What's your availability typically? I know you have your office hours, but are you on like electronic medical records where people can go in and see maybe notes or test results, and then if they got questions, they can email you, so you're in the system?
Mm-hmm. Absolutely. So we have the EMR. We most times patients, based on their preference, they might prefer to call in to the front desk, or they can decide to send messages via something we call My Chat.
Right.
Yeah, and then from there we respond, and based on the acuity of the message, is either we have them come in, or we give them a call back based on whatever they wanted.
Yeah.
Mm-hmm.
That's so good to know. You emphasize patient-centered care. What does that look like in a typical visit, even when you got 6 people in the room?
Mm-hmm.
And I want to know how you get 6 people in the room. How big is your exam room?
We're probably pushing it sometimes with that amount of patients. A couple different things. Again, one, it's at the start of the visit trying to say, okay, what's your concern? I may look at their prior medical history ahead of time and see that they have a history of diabetes and high blood pressure and, a lot of different things that I want to discuss, but they may not have any of that on their mind. I once had a patient who I, wanted to discuss his high blood pressure, and he came in and he told me that he couldn't afford to feed himself, that he was sleeping in his truck.
Wow.
So I think being patient-centered means, prioritizing like what someone's coming in there for. That doesn't mean that I can't at some point in that visit talk about blood pressure, but just trying to lead with what's important to them. And if, needed, put kind of, what I want to discuss at the back burner to discuss at the next visit or something like that. Mm-hmm. And then I think, again, it's kind of trying to respect people's values, trying not to be judgmental. A lot of people make decisions that I wouldn't necessarily make for myself, and, vice versa. But that doesn't mean that the decision they're making is wrong. And I try to, not come off like judgmental of other people in that way.
Right. Dr. Nina?
Mm-hmm.
You want to add anything to that, or you good?
Yeah, I think what she said is exactly what I'll say. Just involving them in the care, not just because you've gone to medical school and it's everything you say that matters. No, you just have to also listen and prioritize. After your recommendations, whatever they want, most of the time is what we try to align with.
So both of you are residents.
Mm-hmm.
Do you have to put in more hours than others? Say once you get, you completed everything.
Mm-hmm.
Will you be working as hard as you are now?
No. Well,
what's a typical day? I mean, are you start from 8 in the morning to 8 at night?
It really depends. Every month we're kind of doing different things.
Okay.
So, we're always in the clinic at least a couple times per week throughout the whole year. But every month we may, on top of that, be in the hospital at Freighter, from, sun up to sundown.
Wow.
Or we may be like at a sports medicine clinic seeing patients, and then we're just there from 8 to 5. Most days when we're not in our normal clinic at outreach community health centers.
So you get a variety of experience as you are a family medicine doctor, as opposed to, like you said earlier, a specialty.
Mm-hmm.
But as a family medicine doctor, if you have a patient that comes in and they do have a particular area that needs to be focused on, then would you do a referral to a specialty physician?
Yes. So just to piggyback on what she said, this month, both of us are on our community medicine rotation. So we try to engage more on community activities. Now, what you talked about, family medicine, we're considered the gatekeepers of medicine.
Okay.
So preventative, and then seeing things that if it's out of reach for family medicine, we refer. But then sometimes some patients just want to be referred like ASAP, while other times they want to see what we could do. And then if it's getting like out of hand, then that's the reason to get them referred to a specialist.
All right.
Yeah.
All right. Dr. Griggs, how has your journey from Oakland, California to practicing medicine shaped your perspective on community health? And then what similarities between Oakland, other than the weather, and Milwaukee?
I don't know. I was trying to think of this a little bit because I imagine that you might ask about like, what it was like to be here versus like Oakland, which is my hometown. I feel like there are a lot of similarities that I see. For one, it's kind of around the same size, like in terms of square miles, but then also in terms of like amount of people who are in Oakland and Milwaukee. I think we both have about like 500,000 people like in Milwaukee and then in Oakland as well. We're both by major like bodies of water, Lake Michigan, and then the Pacific Ocean in Oakland. And then like, fairly kind of racially diverse, like, cities as well. In Oakland, though, like things have, obviously changed a lot from when I was a child growing up in Oakland in terms of that.
Right.
There's been a lot of things like gentrification going on in Oakland. It's not necessarily the same, place that existed back when like the Black Panther Party.
Right. Well, nowhere is
established.
Yeah.
So I would say that, growing up in Oakland, I so many of my different relatives, including like my mom, my aunt, had a lot of different chronic health problems that really impacted their ability to like engage with us. There were a lot of family vacations that we would go on that my mom couldn't be a part of because she was on dialysis. And it would be a lot to try to, go across the country and try to coordinate dialysis, somewhere. So it really impacted like her ability to be present in our lives at times. Of course, she tried to do everything she could.
Right.
But she couldn't be in her grandchildren's lives as much as, my dad could. So that really just showed me how important health is, not just to like your physical well-being, your mental well-being, but your ability to be engaged with other people and really build relationships with other people and have a good quality of life.
Right.
So, being in Oakland, that's kind of what I saw from like personal experiences with family members, but then also doing like volunteer medical work locally as well. And I try to take that perspective, into like the work that I'm doing now, trying to understand, how does, a patient being sick affect like their community at large and their ability to really be engaged in their community.
Yeah. One of the questions that I have that kind of came up in this discussion is when we think about the social determinants of health, when you're meeting with patients and families, if you identify that there's some other need, are you equipped to refer them to other social services, or how do you manage that?
Yeah. So one thing about the outreach community health centers is that we have a whole lot of um, people doing different things specifically for what you just mentioned. We have the benefits team,
Mm-hmm.
we have transportation team, we have nutrition. So most times what I do is patients come in for maybe to establish care, medical conditions, but when getting a social history from them, you ask about how they're faring, transportation, feeding, housing, and you just notice sometimes that that's actually the main reason they're there.
Right. And
Okay.
not the health, but it's
Yeah,
the other
yeah.
things.
So we tend to get all the history, we refer them, we have people stand by to take care of that. So outreach is really like dense in helping the community in any way possible.
All right.
Yeah.
I know this conversation is getting gooder and gooder, but I also know that our time is almost up, and I want to just share a couple of additional updates and information. First, I want to thank all three of our guests on today who came in this beautiful weather to share this information. Dr. Hillary French, Dr. Jasmine Griggs, and Dr. Nina Akugo. I'm messing it up, but y'all see her beautiful face. She's here. And they are connected to Outreach Community Health Centers. There's a location at 220 West Capitol Drive. The phone number there is 414-727-6320. And Community Heartbeat is here on WNOV twice a month. Your host typically is Ebony Sally. So we want to remind you to always look out, because she brings a wealth of information through the guests that she has, as well as connecting you back to Outreach Community Health Centers. They are community based. And it's so important that we know what we have available. You can follow information on their website so that you know some of the things that they have coming up, because they do things in the community. Our theme today was women's health, Black maternal health, and we kick off the week tomorrow, April 11th. So Black maternal health is the focus starting on tomorrow. And I have had the pleasure of being your guest host. I'm Wanda Montgomery, and many of you know me in different arenas. But I'm guest hosting on this morning, and just want to take 1 second to announce Black Child Development Institute is hosting our annual gala. It's going to be on April 30th this year at the Harley Garage, and we would love to see as many of our Milwaukee people in the audience. Again, thank you for allowing me to come, WNOV, and we wish you well.